My name is Vinny Mellnick. I am an associate professor and chief of abdominal imaging at Washington University in St. Louis, the Mellnick Institute of Radiology. So can a patient with a pacemaker or neurostimulator undergo an MRI? And more broadly, what should a patient think about before undergoing an MRI? So there are a few things for a patient to keep in mind before having an MRI. If you've never had one before, it involves lying in a very strong magnet for approximately 30 minutes to an hour, or potentially more, depending upon the exam you're having. You'll be asked to lie still for the exam. And so if you have claustrophobia or trouble lying still, you should let your doctor know when they're ordering the MRI so that you can have some sedating medications or sometimes potentially choose another type of exam. You will be able to talk to the technologist during the exam via an intercom, but you'll be wearing headphones because the machine makes loud noises. Many MRI exams require patients to have nothing by mouth for several hours before beginning the exam, especially if you're going to have IV contrast injected. It's important to note if you are pregnant or think you could be pregnant, and if you think you are, please tell your doctor and the MRI staff. Also, if you have kidney problems or on dialysis, you should let your MRI technologist know before potentially getting an MRI done. You'll be asked to change into a hospital gown to make sure there's no metal on your body going into the magnet. Importantly, you'll also be asked whether you have any implanted devices or metal within your body. Many times, patients with these items can be imaged safely, but sometimes MRI should be avoided or customized for patients who have these particular devices. If we do an MRI and we don't know about these devices, it can potentially be dangerous, both because of heating the device and potentially causing the device to malfunction. So if you have a pacemaker or a nerve stimulator or other medical device, it's really important for you to note this when you're getting your MRI, but also potentially to have the device name and the manufacturer handy. Oftentimes we can track this information down, but if a patient has it readily available, it really helps. After getting this information, we can determine how safe your device is. Some devices require no special procedures in order to safely do an MRI. Other devices can never be safely imaged in an MRI. And other devices are what we call MRI conditional. That means that special efforts need to be made to ensure that the exam is going to go safely. It might require monitoring by doctors and an MRI physicist during the exam. And in the case of pacemakers, your cardiologist needs to be aware of the exam and help determine what device settings need to be changed in order to perform the MRI safely. So it's really a team effort to image patients who have pacemakers and other devices. And oftentimes these are only performed on specific days or specific times. So importantly, if you have a surgical implant or medical device, make sure that not only your doctor, but the MRI department know about them before you show up for the exam. That will make sure we make your exam safe, and also would avoid getting an exam rescheduled if we only find out about it on the day of your test.